Welcome back. You're still watching Good Morning Namibia, and if you're only joining us right now, we were engaging Walters Kamaya, who is the Control Public Relations Officer in the Ministry of Health and Social Services, to talk to us about a measles outbreak which has been confirmed in the Kunene region. Mr. Kamaya, good morning.
Good morning to you too. Good morning to the listeners.
Thank you so much for making time to talk to us. First things first, kindly just talk to us as to what exactly is measles and why it remains a health concern in Namibia today.
Yes, thank you very much. Measles, it's a virus which is a highly contagious disease that mainly affects children, but it can also occur when we have unvaccinated teenagers and adults. Measles spreads through coughing, sneezing, and close contacts with the infected people. And then one of their symptoms or the symptoms of measles, usually they can start to manifest themselves from 10 to 14 days after one has been exposed to the virus. It is a disease also that has small sores on the body, and then especially if somebody has it, there will be trouble by itching and so other things.
All right. We do understand that Namibia has made progress with vaccinations in the past, but what are some of the factors that might have contributed to this new outbreak in the Kunene region?
Yes, what has prompted that when the ministry trying to do some investigation of the outbreak in Opuwo, we discovered that most of the cases, out of the 20 total cases that we received, most of these affected cases were not vaccinated. Children were not vaccinated. So that's why the Minister of Health and Social Services, when we come up with vaccination campaigns, we encourage our people that they are so contagious viruses that if one is not vaccinated against it, that person stands a very high chance to get them. These are vaccinations that are being given. Maybe we say that measles is usually vaccinated, or measles is a preventable disease, and the ministry, it's part of its normal routine program to provide 2 doses of measles vaccines to the children. 1 dose we give the child when the child is 9 months old, and then up to 15 months old. So we discovered that most of the children who has been attacked by measles were not vaccinated at all. So those are the dangers and the risks involved when a child misses his or her vaccine.
Yeah. From what you're seeing on the ground, how serious is the situation in Opuwo right now? How many confirmed and suspected cases do we currently have? And what is the ministry doing in order to monitor the spread?
Yes, at a time when we declared this on the 12th of September, there were only 20 cases which were suspected and reported, and these were laboratory investigated, and then 10 of them were tested positive, and then 8, per the guideline of the ministry, when 2 out of 5 suspected measles cases are laboratory confirmed, that automatically translates into the measles outbreak. However, the ministry has taken a bold step whereby the ministry wants to reassure the public that adequate measures have been taken, and that includes the ministry has strengthened its surveillance activities to be able to timely detect further cases. The ministry also, we have intensified our public awareness education in Opuwo district. Measles vaccination campaign is also being ramped up in the areas where cases are being reported, covering children from 6 months to 15 years old. Also, as of 12 September 2025, a number of 1,525 children were vaccinated. So the ministry is trying to monitor the situation to curb it so that it does not spread further. We have deployed, or we are yet to deploy, some teams to go and to be on the ground to monitor and to conduct the vaccination campaigns in the areas where these cases have been reported.
All right. Are there perhaps any fatalities or severe complications reported at this point?
Sorry?
Are there perhaps any fatalities or severe complications reported at this point?
Yes, there are no much complications. They are just normal. There is no death that has been reported. All cases, they are under control. The ministry is happy. Even the people, they are trying to be on board, unlike in the past. So all the cases, the condition is stable. And then that makes us as a ministry also to say that we are trying to control it. There is no much harm that has been reported. All the cases are in the stable condition.
Mr. Kamaya, how is the Ministry of Health and Social Services addressing vaccination coverage, in the hard-to-reach communities, specifically the rural areas in the Kunene region?
Yes, even those ones that are classified as hard-to-reach areas, previously the ministry would always not sit down and say these are hard-to-reach areas, places, because the people who live there, they should have access to all the places. So the ministry just looks at it that what is it that we need to do as a ministry to reach to those people when the need arises. I remember previously in places like Opuwo and other floodplain places, in most cases when the condition dictates that we can reach those people by means of a helicopter, that we have done. But now all the places, they can be reached by road, though that the hours that you spend on a very short distance, it's longer than normal. But however, the struggle is real, and then when we want to reach our people, there is no excuse. For us, when we say that these are hard-to-reach areas, we just speak of the planning. How do we get to them? What should we have? Do we need to move by road? Do we need to walk? Do we need to fly or whatsoever? But for now, those places, they are not much affected. Most of the areas where these cases have been identified, they are reachable cases. And then our people on the ground, as I have said, they've vaccinated more than 1,525 cases. There is no complaints of not able to reach to some places for now, fortunately.
All right. Now, looking ahead, Mr. Kamaya, once this outbreak is under control, what steps are being taken to make sure that something like this does not happen again, especially in the hard-to-reach areas?
We usually say prevention is better than cure. When the Minister of Health and Social Services comes, we usually go to our people. We give what we call public health education awareness to the people. But the issue that we have is the issue of taking heed to that message. Sometimes if we do not cooperate, so those are the dangers that we are likely to face, the outbreaks. So when we speak of the hygiene, when we speak of any vaccination, and then some people, for some reason, decide to resort or decide not to cooperate with the ministry. And then in an area where people become anti-vaxxers, those are the results. We'll have the outbreaks. But if we are to all agree and cooperate with the Minister of Health and Social Services, staff members, based on advices that they are giving us, we should not be having these types of outbreaks, honestly speaking. So what I can appeal to the people is that when we come to them, our people, to say that they should bring their kids for vaccination, like that one I said, when they are 9 months to when they are 15 months, they should be given 2 doses. Definitely they will be able. This is a preventable disease. They should be able to be protected against diseases such as measles or viruses such as measles and many others.
Well, Mr. Kamaya, thank you so much for making time to talk to us this morning.
It was my pleasure having me on this platform. Bye-bye to you and the listeners.
All right.